do insurance-based medicine through your hospital or the clinic that your insurance or medical provider is covered under, that insurance dictates the amount of time that you can have with your practitioner. That insurance also dictates what you can talk about and for how long. So let's
I
say,
didn't know. Well, I didn't even know that at all. Insurance tells you how long you look at a patient.
yeah, so there's units of care that insurance dictates that are typically 10 to 15 minutes a unit. So let's say I want to go to my primary care doctor and I have symptoms. Let's just make up something. I have symptoms of headaches and I'm concerned about my family medical history of heart disease, which is very common, right? I'm just making something up. And I want to talk about both. I have to schedule a separate visit on a separate day for the second item. You only can talk about one thing. This is in the last couple of years, 3 years probably, that insurance has said this. They've also created a lot more basically barriers between you and your doctor. So there's something called pre-authorizations that you have to get for whether it's durable medical equipment, if you have a physical medicine condition like either a bum knee or back pain or neck pain, that durable medical equipment has to be, pre-authorized by your insurance. So that can mean that you have to pay a staff member 2 hours to be on hold for an hour and a half to talk to someone for 20 to 30 minutes to get the authorization so that your patient can have their insurance cover that durable medical equipment. So insurance is essentially the very expensive middleman that takes typically everything in medicine and multiplies the cost 10 times, 10x. That goes for your lab test, that goes for everything. And then they're also creating the price of your medications. So when you pick up your medication at your local Rite Aid or Walgreens pharmacy, the price that you're paying is the agreed upon price that insurance and the pharmaceutical companies have come together and said, okay, this is the price of this medication with this insurance. And then you usually get an estimate of benefits, an EOB invoice that says your insurance was billed for this for X amount of zeros behind a number. And this is how much your insurance was billed. And this is how much, and then you get a bill 2 months later, a month later, it says this is how much this costs. That urgent care visit was $175. You have to pay your $20 copay. So a lot of the costs are hidden and people don't understand that when they're paying for a copay, they're paying for their medications, they're paying for their premiums for their insurance, and then they're paying for all these extras on top of that they don't read their insurance plans. Typically in cities like Seattle, they're very corporate. They're getting their insurance through their employer. They don't even really remember what they signed up for. They may know their deductible, they may not. And they don't know what's covered. They don't know what they basically signed up to pay for. They're still paying for that. They got a little bit of a wholesale or like group discount through the corporation where they're getting a little bit less premium that they're paying per month for pretty good insurance. If they were to pay private, it would be probably $150 to $300 more per month, depending on their age group. So since insurance is essentially you're paying somebody to be have a little bit of buy-in financially into your sick care. They're
Sure.
great for, you break that femur skiing or snowboarding, you hit a tree and you have a head injury. For acute care, they're not great for chronic care. They're not great for recovering from that fracture or that head injury. They're going to give you medications for chronic conditions that are band-aids or suppressive. So when I had a concussion, I went to my neurologist at a hospital I won't say the name of in Seattle. And the neurologist said to me, my MD neurologist said point blank, it would actually been better if you had actually fractured your skull. From the research, we can give you more muscle relaxers and switch you to another one that's experimental off-label use for concussions that an MD from Europe gave a presentation on. And I was like, oh, great. So I can sleep 12 hours every day and feel like a zombie every morning, which already isn't really working well for me in the winter in Seattle when it's dark and gray out. And they had nothing. And they're great if you need brain surgery, neurosurgeons and all that stuff. Miraculous, amazing what we can do now. They're great if you need to get cancer taken out of your body, and then some cancer treatments that have there's a lot of developments. that's been happening in cancer, even though in the last 50 plus years, there's been no appreciable benefit that has moved the needle drastically, maybe more than 1% in preventing cancer deaths.